So you've decided to apply to Dental Hygiene and Therapy, a super competitive course, but one that I'm going to help you to get into with the exact advice that I've put together from years of helping students get into hygiene and therapy. So I've helped nurses, A-level students, college leavers, people from even radiography or other healthcare backgrounds to secure interviews for hygiene and therapy. And I looked back at all the personal statements that I've helped to write, review, or even edit, and I noticed similarities in the people who do get the majority of their interviews. Now, each university does have slightly different criteria that they use to mark your personal statement, but if you've got the guide, you can see the key criteria that they look for. You want to assess your personal statement against these key criteria to see what score you'd get, and you just want to imagine for each key criteria they're giving you a score out of 5. How well are your experiences aligning with the key criteria? So I'm going to go through the key criteria here as well. The first thing is showing a clear motivation for dental hygiene and therapy. So this is your why, your motivation. Now, the personal statement structure is split into 3 questions. The first one is, why do you want to study this course or subject? So this is why you want to study hygiene and therapy. Why not dentistry? So being really specific here, and you need to mention dental hygiene and therapy because it's quite a long word. After the first time you mention it, you can just abbreviate it. So to DH or DHT if you're applying to both hygiene and therapy. And then you can continue to use the abbreviation throughout the rest of the statement as long as you abbreviate it the first time. So why do you want to study this course? Make sure you mention dental hygiene and therapy, not dentistry. I've seen far too many statements use the word dentistry instead. Dentistry is a different career, and I know people think they're referring to the dental field, but if you're mentioning the dental field, say dental field, not dentistry. So you're applying to dental hygiene and therapy. What is your reason why? What is your main motivation? Has it been a collection of different experiences? Maybe you were a carer for your granddad and they ended up getting periodontal disease. Could it be your experience with dentistry? Maybe you went through a long period of orthodontic treatment. I have seen braces being overused, but it's completely fine to add to your personal statement. If that was important to you and you can relate it back to your motivation, that is completely fine to do. It can be a little bit cliche, but it has worked and it still works really well. Something else you can mention, if you're a dental nurse, you could talk about the years of dental nursing that you've had, or even if you've not done dental nursing for a long time, talk about maybe a specific case or an experience you had. So this is a really good part where you can mention their scope of practice. Scope of practice is so important to understand. These are the roles and responsibilities that a hygienist or therapist have. They want to see so much more than that. They want to see you understand the comprehensive roles. Another thing in that first answer is just seeing a clear motivation. Do you definitely want to do this? If you're a nurse or an A-level student and maybe you mention that you're just interested in education, prevention, diet advice, they might be thinking, okay, they'd be fine with nursing and maybe just doing an oral health education course or doing the level 4 oral health practitioner course. If you do have space in the first answer, you can also mention maybe an article, maybe a research paper that really interested you. So a good way to find this is going into the British Dental Journal, or there are other journals out there as well. That is something you can definitely pick up on and mention in your personal statement, and it really does make you stand out. Just mentioning like a point on there and why that's interested you and why it's further motivated you to tackle disease can be really impactful as well. It's also an opportunity where you could even put in some volunteering. You could even mention a bit about your nursing or employment or some volunteering that you've done. A lot of this will be expanded on in answer 3 as well, but just anything that's motivated you. Maybe it was your virtual work experience, in-person work experience. You can expand on it a little bit here and just really state why it's important to you, and a clear motivation can definitely make you stand out. Making it emotive can be really helpful as well, and a lot of people struggle to write emotively, and I think that's the biggest challenge. Is so many of you have the knowledge and the skills to be a great hygienist therapist, but just not knowing how to write it emotively and impactfully. There is a person behind there that's reading it. We're all human. Anything emotive or gripping can evoke emotion and intrigue someone to read on. Yeah, so the first answer, all about your motivation, your why, your reasoning, impactful experience that you had. Now the second question is, how have your studies or your education better prepared you for the course? This is a really specific question. They're looking for a specific answer. So most of you would have studied A-levels, maybe biology, chemistry, psychology is a popular one. Another one is doing an access course. So similar access courses, they have biology and chemistry content. So you want to mention something about what you study that actually stood out to you. So for example, if you studied biology, maybe it was a lab practical where you were dissecting the eye or dissecting something that really intrigued you because it was so practical. Or maybe you studied psychology and you were learning about phobias and that really interested you. I have seen phobias mentioned a few times related to psychology, so maybe don't mention that one. Another one with psychology or sociology could be understanding behavior, socioeconomic status, how that impacts healthcare. It could be something unique that you've done as part of the course. So for biology, you might have done a specific research project Maybe you did an EPQ, an extended project qualification, and you discovered something about oral health. Anything like that can be added in here. If you've done something extra at school like the UK Maths Challenge or something where you can show your skills, it's a good place to mention it because they are asking how has it better prepared you for the course. Think about skills like manual dexterity. You would have done practicals. Think about essay writing. During your degree, you're going to do maybe a dissertation or a research project, so you can talk about independent research. You can even mention books, podcasts, or research articles here as well. You don't have to write a huge amount in this area. It has to be a minimum of 350 characters, but maybe a paragraph or 2 smaller paragraphs will be completely fine. For healthcare courses, especially dental hygiene and therapy, you need to have more in your third answer. The reason for that is because they really want to see beyond your education, what have you done that's extra? And it's such a people-based career, so you want to show things like empathy, communication, teamwork, leadership, problem solving, resilience. You don't have to mention every single one, but these are the ones that a lot of universities place emphasis on. Because you're applying to 5 different universities, you kind of want to show a bit about each different skill. So communication, teamwork, resilience are always great ones. Empathy is a good one to add in there. Third question is asking, what experiences have you had outside of education and why have they been useful? So they're directly asking you here to talk more about what you've done beyond the subjects. So this could be work experience, it could be volunteering, it could be a job you've had, it could be a summer program you've done, maybe a taster session, maybe you've done the future Discover Dentistry course or the virtual work experience with SpringPod. This is a great opportunity. There's so much you can say here. If you haven't got any volunteering so far, it is definitely worth getting some, especially if you've not had much exposure to working with different types of people of all different ages. Here is where you want to use the PER method. STAR method is where you mention a situation, a task, an action, a result, and reflection. I think the PER method works a bit better, where you give a point, you then give an example, and you reflect on it. So I'm going to give you an example. So I did some volunteering at a care home. After volunteering weekly at a care home for 6 months, I was able to care for people with dementia. These are all very elderly patients, and I got to speak to them and learn how to adapt my communication. I would play games with them. Not only did I learn to improve my communication during this time, I got to work with the team to plan activities. I was able to juggle this around my extracurriculars and A-levels, and that really built my time management skills. I also get to speak to the residents' family members, and we were having lots of sensitive conversations, and it's difficult for family members to see their loved ones with dementia. It is really, really difficult, and that evoked my empathy. So the point here was that I volunteered weekly at a care home for 6 months. So immediately got that in there within the first line. Second thing, I've mentioned the type of patients or residents that I was working with. So I was volunteering with those who had dementia or maybe other medical conditions. I gave a specific example of what I did. So I was helping to play games, organize activities as part of a team. And then I've also mentioned communication and speaking with their loved ones as well. So empathy is in there. So teamwork, empathy, communication. Okay, so just to summarize, the first question, all about your motivation, your why. Could be a single experience, it could be a collection of experiences. Question 2 is all about your education, so you can briefly mention what you studied and why that was important to you. So whether that was A-levels, an access course, maybe a specific module that interested you. The more specific you are, the better it is. Go beyond the subjects as well. Where did that syllabus take you? You went beyond the syllabus to read a book, listen to a podcast, read an article, maybe you did a taster course. The third answer is going to be all about what you've done outside of your education. So in the third answer, you don't want to mention anything to do with A-levels or college at this point. It can be something else you've done, so mentoring, volunteering, working in a job, working with the community. Some people go to their local temple or church and do some volunteering there. These are all things that can be mentioned. Now, they're not going to mark you down if you mentioned work experience in paragraph 1 but didn't mention it in paragraph 3. They're really marking you against the criteria, not where it is in the statement. If you're struggling to write your personal statement and you just can't get the words on paper, and put all of your experiences down, and you can always book in for editing as long as there's availability, or for a comprehensive review, and we can go through your statement together.